Hey Ravi, what are you doing?
Harrison, Radhe Radhe, today we are studying the radius bone. Radius is one of the two long bones of the forearm located on the lateral thumb side with the ulna on the medial side. It plays a vital role in forearm rotation, wrist movement, and transmission of force from hand to elbow. Anatomy of radius. Radius consists proximal end, shaft, and distal end. Proximal end head disc shaped articulates with capitulum of humerus make a humeroradial joint. Radial notch of ulna, proximum radio-ulnar joint. Neck narrow region just below the head. Radial tuberosity, roughened area on medial side, provide attachment of biceps brachii tendon. Shaft triangular in cross section. Border anterior, posterior, and medial interosseous border. Surface anterior, posterior, and lateral. Distal end, styloid process, lateral projection of ligament attachment, ulnar notch, articulate with the head of ulna, carpal, articulate, surface, articulate with scaphoid and lunate bone of the wrist, muscle attachment to the radius. Several muscles involved in elbow flexion, forearm rotation, and wrist movement. Muscle attached to proximal radius. Biceps brachii insert into radial tuberosity. Powerful supinator and elbow flexor. Supinator wraps around the third of the radius responsive for attachment to the shaft. Pronator teres inserted into the lateral surface cause pronation. Flexor digitorum superficialis. Flexor pollicis longus. Pronator quadratus. Brachioradialis inserted near styloid process, flex elbow in mid-prone position. Extensor carpi radialis brevis and longus, closely related to originate from humerus. Pathology of radius fracture, Colles fracture, most common distal radius fracture, dorsal displacement of distal fragment, usually due to the fall on outstretched hand. Smith fracture, reverse to the Colles fracture, volar displacement. Barton's fracture, intra-articular fracture of distal radius, radial hand fracture, common after a fall of out hand with elbow extended. Congenital and development disorder, radial club hand, partial or complete absence of radius causing deformity of the forearm and hand, inflammatory and degenerative conditions, osteoarthritis and rheumatoid arthritis, nerve and tissue involvement, posterior intraosseous nerve injury, tenosynovitis and tendinitis injuries.